In medical rounds, Hartford Healthcare recently received its first shipment of Paxlovid. That's a COVID-19 oral antiviral treatment. And here tonight to talk more about the drug is Eric Arlia, Vice President of Pharmacy at Hartford Healthcare. Eric, thank you very much for being with us. This is obviously very exciting as we deal with these growing cases. Talk to us a little bit about this new drug. What exactly is it?
Sure. Thank you for having me. So Paxlovid is our first oral treatment for patients experiencing COVID. Prior to its emergency use authorization, all of our options were given intravenously or intramuscularly, which meant patients had to be treated either in the hospital or in a clinic and then be observed for a period after that. So this really gives us an option to manage a certain patient subset in the home.
How does it work? So we would get it once we're diagnosed and pick it up at a pharmacy and take it at home, or does it have to be taken with the doctor or something like that?
Sure. So first thing I want to say is just a reminder for everyone that these medicines, and there'll probably be more that come after it, are not intended to be replacements for vaccine. It's another tool for us for people who do become infected. The goal really is to keep them from becoming seriously ill. So Paxlovid works by blocking the COVID virus from replicating. It's actually paired with a second drug that was already on the market that increases the drug level of the new antiviral. This medicine would be prescribed. There are only some pharmacies in the state that carry it. There isn't enough supply for all pharmacies at this point. Within our system, we are triaging all prospective patients through our outpatient triage center and then dispensing the medication through our 2 retail pharmacies.
So right now, obviously, it's not too easy to get, but who would qualify for the medication?
So the groups of people we're looking for are those who are more at risk to become severely ill. So a lot of the things we've talked about throughout the pandemic, people with comorbidities like diabetes or heart disease, people over a certain age, obesity, there's some other factors as well. There's also some other considerations with the Paxlovid that does have some drug interactions. So our providers will be checking with prospective patients for what medicines they currently take. Also, they need to check their kidney function to see if they're a good candidate.
Well, before we let you go, Eric, I think you made a very good point right there. You're still encouraging people, number one, get the vaccine, get the boosters.
Absolutely. It's still our number one tool in the tool shed. It's exciting to add more to it, but that is still the number one key of the arsenal.
Eric Arlia from Hartford Healthcare, thank you so much for joining us tonight. We appreciate your time.
Thank you.
Now, for more information about the pill or anything COVID related, of course, you can go to hartfordhealthcare.org/COVID.